Dr. Sharfstein, what did Governor Cuomo, what did Mayor de Blasio, and what did they and their medical experts get right?
Well, they got right that the virus needed to take priority, that the threat of the virus was practically existential to New York, and that, this was the number one concern. And if they could get this fixed, then other things could happen. And I think that was extremely important, and they conveyed that sense of urgency through all those press conferences and everything else. The second thing is, I think people in New York really understood that, both because of the leadership and because of the sirens and all the things that affected them. And that really mattered for what people did then.
And just one image here, folks. I live right up by the Mount Sinai Hospital complex, and I can tell you the sirens went all night, and at one point I counted 8 ambulances outside Mount Sinai Emergency in the absolute crisis of this. I believe that was back in April. Joshua Sharfstein, what do they need to do in Texas and Florida to do a New York state of mind?
Well, I think it's again, prioritizing the virus, getting those levels down so that they can safely do things like open schools and go back to some, essential activities that are threatened by coronavirus. I think, the leadership, the messaging has to be clear, consistent, constant, and there needs to be, if not a total shutdown like they had in New York, a restriction on some of the activities until they really can drive that number down and not, let up until it's really low enough.
Dr. Sharfstein, how close to herd immunity are we?
It's obviously a question on everyone's mind, and nobody knows for sure. And, I think the fact that the virus affects a lot of people without them knowing it, and the number of people it affects without them knowing it can be estimated at different numbers, makes people wonder whether more people are infected than we really appreciate, which would make it harder for the virus to transmit. An important concept, though, is herd immunity in this context is not, absolute. It's relative, meaning it's not like suddenly we have herd immunity and now the virus is just going to go away. It's more like we slowly get more immunity in the population, and it's just a little bit harder to spread. At some point, that'll help push some areas into a time when the virus is going down in the population, but it could still come up if it has the right circumstances. So it's nothing to wait for, like we wake up one day and we have herd immunity. It'd be more like slowly we're seeing that it's just harder for the virus to spread in certain places. And that may partly be the case in New York, that it's, particularly in areas that had such high rates of infection, that it's a little bit harder for the virus to get around there. And that's just an extra level of security. But still, if people were reckless in New York, they could get coronavirus. So I think we shouldn't be waiting for herd immunity. We should be taking steps to protect ourselves, and then maybe we'll start to see the virus come down eventually.
Let's talk about schools. You mentioned it just a moment ago. I saw a report over the weekend. 97,000 children around the United States tested positive in the last 2 weeks of July. That's around a quarter of those tested. Is it the right decision to try and reopen schools in September? There are lots of other factors you need to put into the mix, but nevertheless, we still have significant numbers of children that are carrying the virus. They may be asymptomatic, but they still have it.
I think it's a very questionable decision in areas with high rates of viral spread. I think it's extremely likely, particularly high school students who are mixing with each other in classes and all those things, are going to pass the virus around, and potentially other people could get infected. Some kids could get quite sick, their family members. That's what we want to avoid. That's why, job one is reducing community transmission to a reasonable level. And places that are pushing forward without reducing community transmission are risking it. Number two, you've got to have precautions in schools. And what's clear is that some schools aren't really taking precautions or any serious precautions. So when you combine high rates of community spread with very few precautions in schools, in my mind, that's not good. But on the other hand, there are areas like in New York where the community transmissions come way down, and you can take precautions in schools, then, I think that the American Academy of Pediatrics and others are right, that the value of school is just extraordinary, and kids are being harmed by the lack of school, and it was worth moving forward, and the evidence from other countries is it can be done without becoming a source of infection.